Today we're talking about trauma and anxiety and the role it plays in our personal and professional lives. To begin with, I just wanted to talk about what anxiety is, which is intense or vague fear that triggers physical and emotional responses that can be out of proportion to the current circumstances. Now, it's not always out of proportion. If you have someone with a gun who is threatening your life, to have some intense fear in that situation is totally appropriate. But often when it comes to anxiety, it's more of a vague fear, not even always being able to put our finger on exactly why we're so uncomfortable and why we're having such a big physical and emotional response. So anxiety is a form of fear, and I thought it important for us to talk about the stages that we go through in getting to a truly fearful state. So first of all, we have a perception. We perceive our environment internally or externally, and we notice a threat. If it's not too intense of a threat, we begin to think about strategies in order to get ourselves out of this situation. On the heels of those thoughts, we begin to feel emotionally. It isn't long before that emotional response is followed by a physiological response. And then we have the natural consequences of this fear response. Now, sometimes it isn't exactly in this order, and it's often a very, very rapid progression. We perceive a threat. Sometimes if it's an intense threat, we immediately go into an autonomic physiological response where our central nervous system is involved and stress hormones are released. And then we begin to think and feel later. But these are the basic components of a cycle of fear. So when does fear become anxiety? It's when the prolonged experience of fear due to real or perceived threats becomes chronic. Now that's a Sydney definition. There are similar definitions probably out there, although when I was looking at some of the Mayo and WebMD sites and some other people talked about anxiety, there were very long, sort of convoluted definitions. But for my purposes, when I'm working with people as a coach and as a consultant, I experience their anxiety usually as the result of a prolonged exposure to a fear response. I don't think we can talk about anxiety without going back and revisiting complex PTSD that we talked about when we were in the post-traumatic stress unit of this group. Chronic post-traumatic stress is not that far removed from chronic anxiety, and I think it's really important for you to begin reflecting on what exactly you're experiencing so that when you do go to a psychiatrist or psychologist, should you need to, you're very clear in your reporting about what it is that's going on for you. So in chronic post-traumatic stress or complex PTSD, it results from cumulative high-level stress over time. This can be from delivering bad news repeatedly to patients and their families, especially surgeons and emergency room physicians have that issue. Continuous exposure to verbal abuse in your work environment or in your training, sustained bullying, multiple exposures to trauma or abuse over time. That can mean from your childhood and in your adult life. So if you have had a history of trauma in your childhood or even one traumatic event, and then you go into medical training and you're exposed to trauma repeatedly, you can develop complex PTSD. Accidents, deaths, violence that you witness can contribute to this, as well as sexual violence or violent interactions that you experience either personally or vicariously. So, what are anxiety symptoms as compared to the complex PTSD? First, it's usually a restlessness or agitation that people describe, shallow, rapid breathing, racing heart, maybe heart palpitations, dizziness or feeling rummy headed and unclear in your thinking, obsessive worrying that can be, intrusive thoughts that just barge in when you least expect them, an inability to focus, avoidance of things that you know you should do because when you start to get close to it, you start to feel anxious, and somaticizing from headaches to GI to chronic pain, sometimes IBS, a whole host of physical symptoms as a result of anxiety. Now, this is not a comprehensive list. Everyone responds to anxiety in different ways. And so there are many, many, many characteristics of anxiety that may be unique to you. Some people almost describe their anxiety coming on like someone who's getting a migraine and has sort of that pre-migraine signal where there's a visual distortion or an auditory distortion that comes before the migraine actually is made manifest. Same with anxiety. Sometimes people feel it coming on. It also creates insomnia or sleep disruption. Sometimes people report being able to just go right to sleep, but then they wake up in the middle of the night obsessing and worrying. When we have anxiety over a long period of time, it fuels our self-doubt. It can create in us a desire to overcompensate because we're feeling badly about who we are and we're not able to accurately assess our skill set and how we're doing. So we undervalue ourselves. We can become defensive over time. It's easy to withdraw or become secretive because people start to worry about you. They come up to you, are you okay? You seem like something might be wrong. Our family members worry about us. And so rather than asking for the help we need with our anxiety, often we go underground with it. And ultimately, we can feel ashamed. I wanted to share anxiety cycle clip art that I found that I thought was pretty good. Usually there's a trigger that starts this whole anxiety response. It can be a trigger that's actually an event that happens. It can be a thought. It can be a smell. It can be a physical sensation. It can be that sort of deja vu experience that many times we have. So there's this initial trigger, and then we move into an anxious response. Here's the shallow breathing. We have muscle tension, more shortness of breath. This brings on fatigue, less and less energy for doing things because we're just so stressed out. Our anxiety increases in this section. We then start to avoid and become paralyzed, more shortness of breath, and then the whole cycle starts again unless it resolves. So the trigger, we go through the anxiety and the physical sensations. When we get to more shortness of breath, that's where we're starting to escalate. Then the fatigue hits, and that's our body's attempt to slow us down and stop the process. And then we cooperate with our body by wanting to avoid. We feel paralyzed, and we're sort of stuck in this cycle of anxiety. It's not a full-blown panic attack, but it's an anxiety cycle that usually we go through in about 30 minutes. But if you have sustained long-term chronic anxiety or a full-blown anxiety disorder, then you can go through this for hours at a time. I even read where some people go through this for days at a time. Now, the panic attack cycle, which is a more extreme version of anxiety, is when the anxiety leads to a full-blown panic attack where we feel as if we're losing our minds, we're losing control over our bodies, we think that we're having a heart attack. Sometimes we're incontinent or start profusely sweating. We're afraid of having another one, which creates more anxiety, and then we have another panic attack, and then there's more fear. So you can see where this panic attack cycle is incredibly intense. And so for those of you that have panic attacks, you certainly have my empathy, and I'm sure everyone else in this group, because it becomes this vicious cycle where, you know, the anxiety fuels the panic, and the panic being so intense creates more anxiety about having another one or even getting through the one you're in. And then it becomes, I guess, for want of a better word, just incredibly intense. But the good news is we can shift the patterns. Now, sometimes that does mean that you need pharmaceutical interventions. If you have anxiety to such a degree that it's disrupting your sleep and making it impossible for you to focus at work. So I'm not really going to address the piece that has to do with pharmaceuticals or even supplementation, because I know there are supplements out there that can help bring down your anxiety. But I just want to give you the hope that if you have chronic anxiety that is the result of specific circumstances that you can identify, then we can begin to shift that pattern. One of the ways to begin to shift the pattern is to connect with your intuition. Intuition versus fear. There's a book that was written a few years ago called The Gift of Fear by an ex-FBI professional, and he talks about the times when we dismiss our fear and how that can put us at huge risk. So intuition versus fear would be paying attention to your nagging feelings and persistent thoughts, to the dark humor that may show up, paying attention to that incredulous feeling of wonder, because that may mean that something's up. Pay attention to your anxiety, to any hunches or gut feelings that you may have, to any doubt or hesitation that is present in your mind or in your physiological response. So nagging feelings, persistent, intrusive thoughts that are trying to signal or warn you, humor, wonder that you use in a way that's incredulous, that can be a signal. Sometimes it's like, oh, I just have sort of a weird sense of humor. Well, maybe, but maybe you're also perceiving something that you should pay attention to. And then finally, any type of suspicion that you feel, pay attention. Use your intuition so that you can begin to notice something before it needs to create a full-blown fear or anxiety response. Because sometimes you can just move out of the way, sort of like Aikido. You know, it's a martial arts technique where when someone's coming toward you, you help them come toward you. And then they come right toward you very quickly, more quickly than they anticipate, and then they move right on by, often end up on the ground. So intuition versus fear and anxiety is the preference. So what does changing the anxiety process look like? The typical pattern is to start by feeling alarmed. The alarm brings some form of resistance, and then we begin to feel exhausted. So, you know, we have the trigger, the alarm, then the resistance is our thoughts, our feelings, our autonomic central nervous response, and then that sort of wears us out until we get to a point of exhaustion. What we want to change that pattern to is a brand new pattern. And that's where instead of alarm, we observe and notice our environment. And one of the ways to do that is by being present in our day to day life. When you are highly intellectual and when you're doing lots of analysis in your job, which you all do in working with patients, sometimes you get so into your head and out of your body that you fail to observe and notice what's going on in your environment. And that puts you at risk. So instead of waiting for the alarm to sound, to just begin to be present in your life. And one of the ways to do that is to just, notice as you're walking down the hall and your feet are hitting the floor and your breathing and your movements and just paying attention to how it feels in your body, where you're tense, where you're not tense, is the first step to really getting into that observer space where you notice what's going on. Then secondly, be committed to interrupting the pattern. Once you can observe and notice what's going on, because you are so much further ahead than waiting until there's an alarm and resistance, you can begin to disrupt the pattern of your own volition. You don't have to wait until you're in a state of resistance, escalation, and exhaustion. And then once you interrupt the pattern, you just surrender then. Let go of the tension in your body. Let go of worrying, anxious, obsessive thinking, and just surrender to this new pattern that you've employed. The observer, you interrupt the pattern, and I'm going to give you some tools to interrupt the pattern here in a minute, and then you surrender. So, immediate interventions. First, breathe deeply from your belly. That's huge. I know you think that, taking deep breaths isn't going to change anything. It's not going to change the whole scenario, but if you can breathe deeply from your belly for just, 30 seconds, it helps your body resist going into full-blown panic or releasing all the stress hormones. Notice your surroundings. And one of the ways to do that is to look around the room and count 5 to 10 colors that you see. Brown, red, blue, gray, purple. And then once you count the colors, 1, 2, 3, 4, 5, then you name them like I just did. And then once you name them, you associate an emotion with each other, with each color. So brown might be apathy. Red might be anger. Blue might be tranquility. Purple might be joy. And so once you've done that, where you've taken, 2 or 3 deep belly breaths, then look around the room, notice your surroundings, and quickly count 5 to 10 colors. Name the colors in your mind, and then associate an emotion with the colors. It's a really good way of getting your brain to disconnect from the fear response that wants to happen. Then thirdly, redirect your thoughts and stimulate your mind. So you've breathed deeply from your belly, you've noticed your surroundings, and you've done this little exercise with counting colors, naming colors, and associating an emotion. And now redirect your thought to something that's going to stimulate your mind. Now, most physicians that I know of have something that they like to roll over in their mind that is a problem that they would like to solve. Not a problem that's connected to your anxiety or fear process, but a problem that is challenging, whether that was the most recent crossword puzzle you were working on, whether that's a project you're working on at home, something that's artistic or aesthetic, or something that is analytical or mathematical, or otherwise stimulating of your mind. And this is just for a few minutes. You're not going to stay there. You can come back to the situation with the patient or your supervisor or your coworker. This is just a process that can really take place in just 2 to 3 minutes. And then once you've redirected your thoughts and stimulated your mind, move your body, chew gum, or get ice. Those are 3 suggestions. Moving your body can mean just standing up and walking across the room, or it can mean moving across the room while stretching your neck side to side or stretching your arms into the air. Chewing gum is something that is an activity that keeps your jaws moving. You have your sense of taste that you engage, and it invites your mind and body to disconnect from the anxious, fearful experience that is trying to pull you in. If you moving your body and chewing gum isn't possible or isn't working, then get ice. And ice that you can either hold in the palm of your hand and roll around. It has a way of bringing you back to your body. You are going to feel the ice. You could even pop it in your mouth and suck on the ice. Either way, you're going to have to keep that ice cube moving in order for your hand or your mouth not to get too cold, and it's going to bring you very abruptly to the physicality of your body. And then once you've done this, ask for reassurance. Now that can be internal reassurance or external reassurance. And you can talk to me about that later if you want to. But I think it's really important as the culmination of this exercise to be able to ask for reassurance. Now, there are postventions. That's the interventions that you use in the middle of an anxiety situation. And that's just one template. I have lots and lots and lots of ideas about how to disrupt from the anxiety response. The most important thing is you want it to be a full body experience. You're not just trying to muscle through the anxiety and force yourself to get over it. You're also not just telling yourself to let it go. You're actually paying attention to your body. You're oxygenating yourself. You're moving. You're giving your mind some places to focus that are helpful. And then in the end, you reassure yourself. Very, very important. I didn't get through without a cough. I'm sorry, my cold interrupted here. So postventions. First, record your anxiety episode. Write it down. It can be just it doesn't have to be an essay. You don't have to do a deep and profound exploration of your most recent anxiety episode, but at least block it out in bullets so that you can record what happened. So that you're in that recording identifying the trigger, what escalated it, and how it ultimately resolved. That's really, really important because in breaking these patterns, you're not going to have an overnight success. It is a trajectory. And so you're trying to move the needle from full-blown anxiety or panic attacks or chronic anxiety disorders to a place where you're managing your anxiety and beginning to interrupt and disrupt the cycle of anxiety. So recording the episode, identifying the trigger, what the escalation and resolution process was, really important. Then replay what the successful resolution was 4 to 5 times over in your mind. Now, the successful resolution might have just been you wore yourself out. And if so, that's okay. I want you to replay, go through the anxious process as if you're watching yourself from afar and it's through a window. You're not experiencing it again. You're just watching and remembering. So you go through what triggered it, what escalated it, and then when you get to the resolution, that's where I want you to move forward into the experience, through the window, into the experience of, ah, oh, it's gone, it's resolved, I wore myself out, the boogeyman isn't threatening me anymore, I'm safe. We play that where you're actually entering that phase of resolution on not only a memory, not only from a place of memory, but actual full body visceral response. Because when your body records repeatedly resolution of the anxiety, that is what body, mind, and soul is going to be seeking, what you're going to be looking to achieve. Then allow yourself to reflect and just feel good. I don't care if, you had a full-blown panic attack and the resolution was just getting in your car and driving home. I want you to reflect upon the fact that you made it through it. It resolved in that moment, and you just can feel good that it's behind you. If you actually were able to apply some tools in the situation and disrupt or interrupt the cycle more quickly than usual, then for sure that needs a happy dance, a feel good, and even a reward. Because when you are dealing with stress hormones and negative physiological responses, it's really important to engage the endorphins and dopamine and serotonin and to have a happy dance and reward yourself. Physicians are the worst of anybody I've ever encountered in my life, and I'm in my 50s now. You know, most people are much more prepared to give themselves rewards. Their self-talk is often much, much, much more positive. They're not as perfectionistic. So when you're dealing with these anxiety cycles, it's really important to allow yourself to feel good and reward yourself. And then finally, prepare for the next time so that you say to yourself, this is what happened before. I've recorded it. I've replayed the resolution 4 to 5 times. I've rewarded myself or reflected. I've allowed myself to feel really, really, really good. And rewards can be something just like getting that new book or giving yourself half an hour in the hot tub or taking that walk that you never allow yourself. It doesn't have to be something that is horribly time consuming or that breaks the bank. But at the end of this, it's really important to prepare for the next time because every time it gets a little better. So now it's time to share. We're going to use the chat to share questions. If I can get the audio to work, then we'll also have people who will be responding that way. This has been wonderful to present. And now I really look forward to your feedback and some of your experiences.